Hello everyone, my name is Beata Dobrowolska. I am a nurse and academic teacher at the Medical University of Lublin in Poland. Together with my ETHCOM team representing our university, I would like to present you one of our methods of experiential learning of ethics in nursing and midwifery courses. And this method is named Case Analysis and Filmmaking using Multimedia in Learning Ethics. During this short presentation, I would like to talk about the procedure of how to work with this method, what would you need, what to pay attention at, and actually what outcome you may achieve. As you can see on this slide, this method is based on reflection on cases, fragments of the daily work of nurses and midwives, and the experience of the work of a nurse midwife and its ethical aspects through role-playing based on a previously developed film script, including elements of professional ethics. What do we need to work with this method? First of all, it is good to equip students with a list of references on ethical concepts, code of ethics, patient rights, good materials regarding strategies of ethical decision making, and some other materials which you think would be needed during group work, reflection on cases, and film script preparation. Another issue which is really important, another element, this is the list of cases which should be prepared in advance, and you may also need access to laboratory of nursing or midwifery skills. Sometimes we need this laboratory to record film in simulated nursing midwifery environment using nursing and midwifery tools. Of course, everything depends on the creativity of students, what kind of film they would like to prepare, but it is good to have access to such laboratory. As I mentioned before, we need a list of different cases, shortly describing clinical situations which nurses midwives may experience in their everyday work with patients and family, but also when working with interprofessional teams. It is good to prepare many different cases because, as I would say in a minute, students group draw one case from the list. So it is good if they have possibility to draw their case from different ones. Now I would like to talk about the stages of implementation of this method. So what kind of steps we need to follow in order to work with this method. As you can see on the slide, the first big step is to build the trust between students themselves, but also between students and teacher, and to create so-called team spirit. Of course, we need to inform students about the idea of the method, about its aims, about the procedure, so what kind of steps we need to follow from the beginning to the end in order to achieve aims which we planned. Then we ask students to divide themselves into groups of 4 or 5 people and to choose one leader in each group. As I mentioned, we have the list of different cases, so we ask a leader of each group to draw one case from the list. When our groups have chosen cases, they start to work with this case, reflect, discuss different options, try to find out what kind of ethical issues they have to talk about in each case. Because they are expected to prepare a film script and then to record film, they also need to talk about different roles, description of these roles, environment for the film, and ethical justification of the action needed. The next step is to write the script for the film based on the case which was drawn. When they finish to write the script shortly, they ask teacher for his or her opinion, and when teacher approves the student's script, they have a green light for film recording. They can record their films using mobile phone when they need to have access to laboratory skills. As I mentioned, they can do it. When they finished, all students together watch a film recorded, and finally there's a step of reflection and sharing their experiences regarding what they see, what kind of roles were created, what kind of behavior was witnessed, and how students dealt with different ethical issues involved in the case which they worked on. When it comes to film structure, we expect that film is no longer than 10 minutes, and 6 minutes of the film takes simulated incident from work of nurses and midwives, based of course on the cases chosen, and 4 minutes is intended to clarify the ethical basis of the selected procedure in chosen case. So this 4 minutes actually is for justification why this kind of behavior is accepted ethically, based on ethical concepts, theories, code of ethics, patient rights, etc. To help students when they reflect on their cases and try to write the script for their films, we may ask different questions. On the slide there are a few examples, but of course we may create many other. Depends on the aim which we plan to achieve during using this method. So, for example, we may ask what ethical aspects may be identified in your case, what ethical conceptions are helpful in solution of possible conflicts of values, ethical problems identified in your case. What norms of code of ethics for nurses midwives should be applied in this case? What do you think would be the best action in this specific case? More questions which we may ask are, for example, what is the role of a nurse or midwife in this specific case? How would you like to organize your film? How would you describe different roles in the film which you are going to record? Do you already know how to behave in the film when playing different roles in the film? When film is prepared and all students together watch it and reflect, we may ask another questions. For example, what do you think about behaviors shown in the film considering ethical aspects in nursing midwifery practice? Do you experience any difficulties, barriers, or lack of comfort when working with the case, writing script or recording film? What do you feel when playing roles, for example, a role of patient, nurse, or any other? To conclude, I would like to shortly say about my experience of working with this method. So students working with case, working on scripts, and when preparing their films, involve their deep reflection regarding ethical attitude and behavior, develop their knowledge when searching different solutions in the literature, ethical and legal documents. Moreover, students are engaged in the simulated situations, and because of this, they better understand the fundamentals of ethical conduct, because in the context of professional practice. Students reflect on each verbal and non-verbal message, understand how communication and social skills have their ethical significance, and also when playing roles, this usually result with more sensitive behavior and help to recognize different feelings of people engaged in the story described in the case. For example, they may recognize better patients' feeling, family emotions, professionals, different professionals' emotions and perspective. And for the end, we need to mention about some risks. For example, we need to consider the situation that some students may not feel comfortable with playing roles, which are recorded and then watched by others. So it would be good to discuss this issue at the beginning, and underline that not all students are expected to be involved in being so-called actors in playing roles in the film. Some students, if they do not feel comfortable with being recorded, may prepare technicalities regarding the film. In exceptional cases, if nobody agrees to play roles in a film, we may find different options for visualization of the story included in the case. For example, they may record only voice and use a PowerPoint presentation. Thank you very much for watching this presentation. This tool has been created by the project team representing Medical University of Lublin together with the ETHCOM project consortium.